Hi Catsters, I'm Dr. Karen. During COVID-19, online and telephone consultations became a necessary part of both human and veterinary medicine. And although we're no longer in lockdown, it seems that online vet consultations are here to stay. There's no real substitute for a hands-on in-person examination, but the ability to speak to a vet about a minor illness or injury, a follow-up appointment, or to decide whether or not an animal needs to be seen as an emergency gives owners a lot more freedom and flexibility when it comes to looking after their pets. One obvious limitation, though, of a virtual consultation is that we, the vet, aren't able to physically examine your pet. So that means we're going to be limited as to what we can diagnose and assess. So the more information that you can give us, the better. So I'm going to show you how to perform a basic health check of your pet right here at home in less than 10 minutes. This isn't a replacement for a physical examination at the vet, but it is a way for you to provide some more meaningful information to your vet, as well as to be able to monitor your pet's health at home. The only things that you're going to need to do this health check: a thermometer, something to lubricate that thermometer with, a pen, a watch, and this examination checklist that you can get by going online at catster.com. So let's grab our volunteer and start our 10-minute health check. So Clutch has reluctantly agreed to help me out with this demonstration, but we might substitute one of the other cats in if he gets a little bit fed up with things. The first thing that we're going to start with on our exam is something called the TPR, which is sort of the hallmark of an examination for a patient. It stands for temperature, pulse, and respiration. So if we're not using a stethoscope, there's a couple of places that we can usually get a good heart rate. The first, we're going to check the carotid artery, and that sits in this, we call it the jugular groove, which is just sort of next to the windpipe or the trachea there. My other place is actually if you place your hand alongside the chest on the left-hand side, and it's sort of just behind the shoulder there, you should usually be able to feel that heart beating against the ribs. And third place is feeling the femoral artery, and that's something you can do when they're just standing here quite easily by putting a couple of fingers. It's on the inside of the thigh there, just below the groin. You don't need a huge amount of pressure, and it's something that doesn't bother them too much with your fingers just resting there, taking a pulse rate. So you can do it over 15 seconds and multiply it by 4, or for a more accurate reading, you can actually take the measurement over 60 seconds. On to our temperature taking. Some important things to remember when you are trying to take a cat's temperature at home. Firstly, do not force them to do this. If they're fighting you, then stop. Secondly is do not forget to put lube on your thermometer. The third thing is this is a 2-person job. Do not try to do this on your own. And finally, try to get a fast acting thermometer so you can get this done as quickly as possible. If you're wanting to get a less invasive gauge of their temperature, one way you can do that is to feel the ears and also feeling the pads of their paws. If it's a cool day and the ears and the foot pads are feeling quite warm, that can be an indication that perhaps we've got a little bit of a fever going on. It's not an accurate measurement, but it does at least give us a little bit of a guide. So Cyril has volunteered to help us with this next step, which is checking the gums. What we are looking at by lifting the lip is, I just need to spot some of the pink part of his gum. It's nice and moist. Now, cat gums tend to be paler than dog gums, so that light pink color is quite normal. When I feel them, they're nice and moist. They're not dry or tacky. Capillary refill time, or CRT, as you'll see on the checklist, gives us a little bit of an idea of things like blood pressure, whether there's anemia, any blood loss, and we can gauge that by just pushing on a part of the pink gum, having that blanch white, and measuring how long it takes for that colour to come back. And that should normally be between 1 and 2 seconds. When we're doing an eye exam at home, we're not doing anything, I've got clutch hair everywhere. We're not doing anything too complicated. We're just looking at some basic structures, and I'll show you some basic tests for looking at vision and some reflexes. So firstly, you're just wanting to have a look at the eyes, making sure that they look even, they look symmetrical. We don't have them looking bulging, sunken, uneven. If there's any cloudiness, redness, basically anything that appears grossly abnormal about the appearance of the eyes. Then when we're looking at the pupils, in normal light, you're expecting the width of the pupil to be approximately a third of the diameter of the iris, or the coloured part of the eye. In really bright lights, that pupil should really narrow to a much more narrow slit, and in very low lights, we would expect that pupil to dilate, and it can almost be all the way around to the whole diameter of the iris. So observing that at home is just an important way of making sure the pupils are acting as they should. Next couple of tests we're going to do give us an idea of vision, but also some of the reflexes. The first is something called dazzle reflex, and I'm going to use a little pen light for that. You can use a little torch or even the light on your phone to do this. We turn the lights down a little bit, and I'm going to be just flashing the light toward the eyes, and that's testing how the eyes are receiving that kind of light, and we should just see a blink sort of response to that. The next test is something called menace reflex. It looks at vision and also the reflexes of the eyelids. It's nice and easy. All you are doing is you want to cover one eye with one hand. With the other hand, you're sort of coming at the eye, not too close to the eye, but not too far away either. You're basically just trying to get a blink reflex. And then we do the other eye as well. Perfect. So that just gives us an idea of the way the brain is interpreting that sort of signal. The last thing we're going to do with the eyes is just checking their comfort, looking for whether or not there's any signs of any pressure or pain around the eyes. All that involves is just putting a little bit of pressure over the eyelids. Now the eyes shouldn't feel really firm, and that should be very well tolerated. It shouldn't be painful, and if you're getting a lot of resistance to that examination, we've got a problem. So on the checklist now, we've got our gastrointestinal system, and a lot of that's down to history, our appetite. Is there any vomiting, any diarrhea, any changes going on in that area? And then we're going to have a feel of the abdomen. Is there any bloating? Is it firm? Is it relaxed? A cat's abdomen should be quite soft. Is there any firmness, swelling, any signs of there being any pain or discomfort? You really should be able to almost put all of his body weight onto your hand on the abdomen, and that tells me that he's really quite comfortable in that area. So next on the list is skin. Not going into a great amount of detail, but basically we're just looking for any redness, any crusting, scabs, bumps, bald patches, anything like that over the body. Important to not forget our ears. And as well, not forgetting to check our feet between the toes and the paw pads as well. So last on our list is probably the biggest one, which is the musculoskeletal examination. Part of that involves us just observing our cat, seeing how they're moving. Is there any reluctance to jump up, to jump down? Is there any lameness? Are they scraping any nails when they're walking? Basically anything that's abnormal in their gait, whether they're limping, whether they've slowed down, anything like that needs to be noted there. The next thing we're going to look at is the neck and the spine. So if you're suspicious that there could be any kind of pain or damage or injury to this area, your safest thing is to leave it alone or be very, very careful in your approach with doing this. Essentially, what we're looking to do is lifting, being able to lift the head up, being able to come all the way down, being able to come all the way to one side, and we should really be able to touch almost nose to chest, and then all the way to the other side. With our spine, part of that essentially, we're doing right now just through patting. So we're looking for any areas of tenderness. So just using a little bit more firm pressure as we're coming over behind the neck, over the chest. This here is an area where you're more likely to get a little bit of tenderness, and then just sort of carefully running the tail through your hands as well. Now we're moving on to the limbs. We're just needing to take this sort of in a systematic approach, and I always start from the paws and work my way up. And that means just feeling each little toe, seeing if there's any reaction. At the moment that is purring. Flexing the carpal joint, which is like the wrist joint, extending that joint. Flexing the elbow, and then extending the elbow. Flexing the shoulder, and extending the shoulder. And then we're going to do the same thing on the back leg. So again, feeling our toes, flexing the joint, extending the joint, flexing the knee, extending that knee, flexing the hip, and extending the hip. This is an area where you might get some pain if you've got an older cat. It's an area where they're more likely to have some arthritis, so that is somewhere you need to be quite careful about, but also paying close attention to see what kind of reaction you're getting. So this is something called conscious proprioception, and this is a postural reflex. It basically is checking the message that comes from the foot to the spine, and then also to the brain and back. This reflex is something that Clutch doesn't think about. The foot is moved out of position and it automatically should go back to the right posture. And if there is a delay in that, it's often an indication of potentially spinal injuries or even disc disease. So it's a very, very easy test to run that can give us quite a bit of information. So all that this test involves is we curl the back foot under and it should automatically, very quickly replace itself in the right position. So with cats, often you don't even get the chance to put the foot down, that it's already going back into position. Oh, so hopefully that gives you the confidence to perform a basic health check on your pet at home. But remember, there is no substitute for a physical examination with your vet.